Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. This is the third, maybe the fourth lecture in communication station 4, and this lecture about counseling about disease. In counseling about any disease, the most important thing is to answer the patient concern about his job, about driving, about the complication of the problems that he have. Try to explain it clearly. Try to know what is the exact problem with the patient and answer his concerns clearly. Actually, counseling about disease, there are several diseases that present in the books before, and a lot of scenarios. The most common one is multiple sclerosis. The second one might be epilepsy and chronic obstructive pulmonary disease. Moreover, obesity and migraine, hypothyroidism, mesothelioma, osteoporosis, fibromyalgia, and the Huntington disease, myotonia dystrophica, and transient ischemic attack. All of these, and of course, post-myocardial functional lifestyle modification. All of these scenarios have the same structure, and to discuss it in easy way. If you know exactly what you are talking about, then talk. If you have the right information, then say it loud. If you do not have the right information, do not say it. We'll start with the cause of the diseases. The most common diseases like multiple sclerosis. It's of unknown cause and it's incurable, and it might be controlled by a specific type of medication. The epilepsy itself, it's caused by abnormal electric foci in the brain. The chronic obstructive pulmonary disease by smoking. Obesity, it might be hereditary, it might be long run in some families, or have high incidence in some families, or maybe due to bad lifestyle. The migraine has no specific cause, but there are three theories about migraine. About the hypothyroidism, might be autoimmune, might be postpartum, might be due to surgical, might be due to cancer. The mesothelioma might be due to smoking or other risk factor. Post-myocardial and functional lifestyle modification, it's a long session actually, and they have a lot of talking. We will discuss it later. Osteoporosis, you have to speak about the modifiable and the non-modifiable risk factors in osteoporosis. For fibromyalgia, it's idiopathic, has no specific cause, but has high incidence to occur in some families. Of course, Huntington disease is hereditary disease, and myotonia dystrophy is hereditary also. The transient ischemic attack is caused by embolus or vasculitis, or maybe due to rupture or stroke, rupture aneurysm or stroke. Then explain the pathophysiology of the disease itself by discussing the normal variant first in clear, easy words, then discuss the abnormal. In case of epilepsy, for instance, inside the brain, the messages transfer via electric impulses, and in your case, there is an abnormal focus which give rise to abnormal electric impulses causing your symptoms. And then start to clearly explain what is the symptoms that he might have because of this problem, and the signs that he might have, like losing of consciousness, abnormal movement of your hands and in your legs. you may have a headache after the attack. Then you have to discuss the complication of the disease itself. You may have this attack during driving, which may cause severe harm for you. You may hit yourself in the attack, so just keep away from the hard objects while you are staying at home. You may bite your tongue while in attack. There are also complications and side effects for the medication, mainly in case of pregnancy or in case of female patient that control the epilepsy or the epileptic attack, which will be discussed with you probably when needed. This is the most important part in counseling scenarios, and is the history part. You have to ask the patient with whom you are living with, and are they okay or not. What about your job, and do you have any bad impaction in your job or in your daily activities? What about smoking? Do you smoke, and does smoking and smoking by itself badly affecting your health, and we will refer you to smoking cessation clinic. And about alcohol, as alcohol may make your these specific types of disease, alcohol make it worse, so you have to modify your drinking of alcohol, and if there's a problem in doing that, we may refer you to alcohol modifying group therapy. And about driving in case of epilepsy, or in case myocardial infarction, or in case of transient ischemic attack, you have to stop driving for a period until we will discuss this issue with the high authority of DVLA, and ask him about the past medical history and the family history, and of course about drug history and drug allergy. Yes, in communications there is a history part, and you have to take it, because if you don't or did not take it, you will not has the concern or answer the concern if he had bad impaction on his job, if he will stop driving or not, if he should stop smoking or not, if he has a problem in his house. He may have rheumatoid arthritis, which is severe, and they cannot help his wife at home, which who may have another problem. And about the drug history, if he has any allergy to any type of medication, if he took allergy which may interfere with the medication or the new medications that he will take it. Then the concern you would ask him about, may I ask you what is your concern? In this type of scenarios, the concern mostly might be about the treatment, mainly in case of epilepsy and a pregnant woman, or a woman who wanted to conceive. The second is about driving, like epilepsy or transient ischemic attack, or even diabetes type 1, and the patient wanted to continue driving. About his job, like a patient with rheumatoid arthritis wanted to play piano. About the family, if he need a social worker or he need a occupational therapist to help him at home. About pregnancy, as we told. About recurrence of the attack, like in multiple sclerosis, and if it had a serious complication and she will be on wheelchair later. Then the clinical judgment part, the management plan. You have to tell the patient about the investigation. You will do some blood investigation for the patient. You may do some scanning for his brain, for his chest, according to the case, and the treatment plan for him. You have to tell him about the precautions to be taken, like for the epileptic patient, he must not spend a lot of hours staring in screen like television. He may about the migraine, the precaution, or just to not to eat chocolate or to eat cheese, which may make him suffer more. And then put the multidisciplinary team for the patient according to your case, the consultant and the specialized nurse, the occupational therapist if needed, the social worker if needed, smoking cessation clinic if needed, and alcohol modifying therapy if needed. Then continue your structure or the composition of your lyrics in your song, in your scenario. Recap the patient. Would you tell me please what is the message you will take with you today? And if you have any other concerns, then you have time to finalize your case and tell the patient, I will give you my hospital contact number and I will give you leaflets and brochure and websites to know more about the disease that you have. There's a case of counseling. Actually, in the exam, it's take a little bit more time. You have to tell the patient if you don't have the exact or the real or the correct piece of information. Do not tell the patient wrong information. Just tell him, I don't have this piece of information right now. I will ask my consultant and get back with this piece of information to use the next appointment. Don't go in confrontation with the patient. If the patient if the confrontation of the concern about driving, tell him just do not drive now, and we will discuss this later with you after you discussing this or thinking about this problem. We will discuss it. Just stop driving right now. If he is okay with that, it's okay. If he is not okay with that, just tell the examiner you may make an appointment with a consultant to discuss this issue and assure that the patient will not drive, saving for his life and for others' life, of course, doing no harm for him or for others. I think that's all about the counseling cases. You have to put the plan before entering the room. You have to discuss about the normals, abnormals, the cause, the normals, abnormal pathophysiology, the clinical picture, then the complication, then take the history from the patient, and then put the management plan, asking about the concern, answer it directly, then recap the patient, and finalize your case and ask about any other concern before finishing your case. That's all for today, and thank you. Wassalamu alaikum wa rahmatullahi wa barakatuh.